Good afternoon and welcome to the Human Services Committee meeting. Is there any courtesy of the floor? Could you please come up and state your name and town that you reside, and you can have 5 minutes.
Hi, everyone. I'm David Holland. I reside in Bethlehem Township, Pennsylvania, and I'm a lifelong resident of Northampton County. My main reason for asking for courtesy of the floor, first and foremost, is to thank all of you on the council for taking the time to devote an entire Human Services Committee meeting to Graysdale. It's an important topic. It's a complex topic, and I appreciate you dedicating the time to do that. I'd also like to just take a few seconds to acknowledge the hard work of administration, Graysdale administration, running the nursing home. I know firsthand how difficult that is, and too often we jump into topics of what we need to talk about and some of the challenges without acknowledging the hard work that people do. So I'd like to do that as well. While I'm here, I'll touch on one topic, and that is just recognizing whatever the decisions that are made or the challenges that are happening, that time is of the essence. With Graysdale, as you know, it's one of the few services that the county offers that is in fairly direct competition with the private sector. And the private sector is moving forward at lightning speed with staffing, recruitment, retention, hiring, all those things. I know that because I'm in the hospitals, I'm in the health networks, the Lehigh Valley hospitals and the St. Luke's hospitals as part of my clinical rotations with students at East Stroudsburg. My colleagues, they're constantly looking, assessing, and adapting to the changing workforce and that dynamic environment. And as one of the most pressing, it seems, topics with recruitment and retention, the use of outside agency, we don't have any time to lose in reacting, responding, supporting whatever it is that we need to do to right that situation. As you know, it's unsustainably fiscally. There's a quality care component to all that. So I leave you with just a sense, hopefully, of urgency in dealing with some of these things because, especially with the workforce and the limited workforce in the Lehigh Valley and that finite pool of RNs, LPNs, and CNAs, that whatever decisions are made and whatever the plan is moving forward, that it's done so with some urgency and some expediency. So thank you.
I have a question while he's up there.
I don't normally, but
He used to work at Graysdale, right?
I did.
Any suggestions from, I know you're running for one of these seats. You got any suggestions if you were sitting in one of our seats?
That is a long answer, Mr. Fredo, and I do, but it's
And he
probably
only has 2
for another
minutes left.
probably for another time. But I appreciate you asking.
All right, thank you.
Sure.
Anyone else wish to speak to courtesy of the floor? Your name and the town with which you reside. And
Hi, my name is Stephen Carl. I reside in Salisbury Township, Lehigh County. I am for those of you who don't know me, I am the former assistant administrator at Graysdale. I had a speech prepared, but I won't waste anybody's time. As we know, there are a lot of concerns that come up with Graysdale. I will agree, opportunities for improvement continue at that facility. And I really just want to speak on some of the mistruths that have come from, the management side of Graysdale. When we speak about financials, when we speak about affinity studies, when we speak about staffing, those numbers that are presented to you are edited. They're doctored. They're communicated in a way to present Graysdale in positive light, when there's very little change from those PowerPoints every single month that you guys see. I witnessed you guys asking very appropriate questions about staffing levels and which ones are Graysdale and which ones are agency. And even I myself was told, to bring people on. And in council meetings, they have stated that I had given agency premium shifts. That's not exactly the case. The case is that there's very little staff that even work there. So the people that are picking up are agency. And those are the people who are not disrespected by Graysdale and the management team and the rest of, the county. Graysdale does provide a great service. It is a great facility. We serve many people who need to be there. And as a nurse, I'm compelled to care for those people. Where would they go without Graysdale? But the misappropriation of the funds, of, just the care, everything in that facility really needs to be looked at. So I'm just gonna jump to, unfortunately, I'm very happy to see some of my, former employees and peers here who were recommended not to speak by the union, which is unfortunate. And I would be hopeful that other employees who work there would come up and speak, such as myself, on the negative things that occur at Graysdale and the challenges that they have. But I would recommend that council does do an independent study in the financials or an independent study into the operation of Graysdale that would be separate from oversight through McClure's office or council itself. You guys need to be presented with actual data that had not been edited prior to you receiving it. That's the short and sweet of it.
Okay, thank you.
Thank you. Yes, go for it.
Did you leave under your own accord or were you fired?
I was terminated
When was that?
a year ago.
Thank you.
Thank you.
Anyone else wish to speak to courtesy of the floor? Okay, next we're going to move into a discussion of Graysdale. I
Ms.
think,
Hefner,
yes, Mr. Heckman?
may I make a statement under courtesy of the floor?
Well, considering you're the chair, you could say what you want.
No, well, this is courtesy of the floor. I'm just saying that, excuse me, I'm saying this just as a person and my recommendation to the committee. Graysdale is not an institution. It is a home for hundreds of people. This meeting, it should be an ongoing process to look to make the home safe and sustainable. It might, excuse me, I'm having some problems. It'll only be achieved with the cooperation of all in county government. This home isn't represented by any one office holder. It is part of a larger picture. It is in this meeting of the Human Services Oversight Committee, I hope we do not get into a position of attacking anyone. Nothing will be accomplished if we look back. We must move forward, meet the needs, and address the challenges facing all of us with Graysdale. And most of all, to assure the stability and safety for all the residents and families of those at Graysdale, as well as the county at large. Thank you. That's all I wanted to say.
Thank you. What I'd like to do, there's been a request, and what I'd like to do is start with the discussion of Graysdale and try to get to some of the questions that were asked, but I want to leave enough time for you to get a full ability to do your strategic plan. So how much time do you think you need to present that information? So I can watch my clock and I'll be tight with it. Okay, thank you. So I guess we'll start with some of the questions, if you wanted to approach, and then anyone else you think would be appropriate to answer some of the questions that were asked. I believe some folks did get questions to Aileen, and you were presented with those prior to the meeting, correct?
That is correct.
Thank you.
Alrighty, so I'll start with the questions that we did receive via email. And one of the first questions actually addresses the allegation about the staffing numbers, because I have the actual numbers for you. In nursing right now, full-time nurses, we have 25 out of 89 Graysdale nurses. And we've never been anything but honest about our nursing shortage. For part-time nurses, we have 9 out of 79. And for per diem, that means people that don't have a set schedule but work as needed. We could say, hey, we have an opening, are you available? They can say yes or no, they're not a routine schedule. We have 7 out of 16. And for nurses' aides, we have 59 out of 198. For part-time, we have 14 out of 192. And for per diem, we have 4 out of 16. So that staffing shortage is real. So one of the questions was, could a timeline be provided that indicates when the balance of the nursing staff shifted from a majority of county employees to agency nursing? So numbers really began shifting during COVID. Some team members didn't want to be exposed to COVID for fear of forgetting it themselves, for carrying it home to families. Others didn't want to get vaccinated. So when the vaccine mandate came out, a lot of people left healthcare because they did not want to get vaccinated. And that shift is not unique to Graysdale. It's not unique to nursing homes. It is something that occurred across the country for all healthcare. And healthcare was already facing a shortage of nursing. So direct care, especially nurses, aides, all of those, we were already facing that shortage. We knew with an aging population and less younger people entering the workforce, that was already on the horizon. So this just really accelerated it greatly and really exacerbated that problem. Part of that question also said, as the trend was shifting towards more agency nurses, what was done to try and keep a balance? So we attended all recruiting events at trade and high schools, as well as universities and colleges in the surrounding counties, highlighting the rich pension and benefit packages we offer, as well as tuition assistance and reimbursement, our wellness credit, flexible schedules when we could do that, job advancement, increased pay for experience, and the free daycare coming soon. We also hired a new marketing firm to revamp our website, to enhance our social media presence, and to establish a Graysdale blog and produce videos. We previously advertised on Channel 69 and local billboards, and we continue to utilize Indeed and geofencing for our local free ads. Part of that question then was next, why were those efforts unsuccessful? And as I already said, some people left to COVID and vaccination, and they decided to leave healthcare altogether and not to return. And then it was also compounded by the high rates that agencies do pay and their flexibility of scheduling. So with an agency, they can work whenever they want or not work whenever they want. So we don't have that extreme flexibility. We try to adjust schedules when we can, but we can't offer the same thing that agencies offer. So that compounded the problem. And I would add to that the last time I checked, and I haven't checked recently, but there were 14 states that actually put limits on agencies because some agencies are really milking the system. Pennsylvania is not one of those states that put any limit on agencies. So we're kind of tied.
Could I interrupt you for a moment, just to
Certainly.
clarify?
Yes.
The first number that the 25 out of 89, are you including RNs and LPNs in that count?
Yes.
So those top three are both combined. Do you have a breakout of each discipline available?
I don't at the moment now, but I can get you that.
And then the second half is just CNAs?
Yes.
Thank you.
You're welcome. Our next question was, with the admission of patients into Graysdale that have mental health issues that need treatment beyond typical nursing care, have any of the following, therapist, psychiatrist, case manager, been added to the staff? So we do have contracted mental health services in our building. We use Haven House, which offers mental health services, which include personalized behavior plans, individualized therapy, ongoing support from a certified older adult peer specialist, a collaborative holistic approach that takes into account all of the factors impacting health, and consistent communications with physicians, nurses, social services, and family members. We also use a group called Vital Health, and Vital Health provides a psychiatrist, and we recently added psychological counseling to that as well. And in July, the psychiatry area saw 316 of our residents, and psychology saw 52. In addition, we're working on offering more training to our team members regarding managing persons with mental health issues. So for example, we recently trained and certified 27 team members in mental health first aid. And that's something that we're continuing to look at. We're working with our staff development team to say, okay, what additional training can we give our staff to prepare them to handle the challenges we face? The next question, since the rehab facility began its operation, how many folks have been in and out of the rehab facility? I can't track back since we first started ordering short-term rehab because some of the documentation in the beginning was paper. Now that we're electronic, I do have the number since the area was renovated and reopened, and we have had 579 residents since that time. With regard to individuals who go through the rehab facility, is Gracedale their only option? Again, that's hard to tell like after the fact, but residents in rehab, short-term rehab, usually have a little bit more options because Medicare, private pay insurance, et cetera, the reimbursement rate is greater. So there's a lot of competition to take those residents in among all the places that offer short-term rehab. But we can become the only option if the resident's circumstance is more challenging. And that could be not just a resident with a behavior challenge. It could be if there's not a clear-cut discharge plan back to home. So if it looks questionable for them to go back to home, some short-term rehabs will focus on, or nursing homes will focus only on short-term rehab and say, we're not doing long-term care. That way they're capturing that cream of that payment and then not keeping them afterwards. So if they think there's a chance that that resident's not going to be able to leave, they don't take them. So that's sometimes a challenge where a person may have trouble getting into a short-term rehab if it's not clear that they can go home again. We are more of a last resort sometimes for long-term stay residents. Not all nursing homes are Medicaid certified. So if the nursing home is not Medicaid certified and the person doesn't have the money to pay for long-term care, they don't have long-term care insurance, sometimes we can become the only option for those residents. Or, sometimes residents are homeless and can't manage on their own anymore. They go to the hospital has a plan of safe discharge. Some nursing homes will say, they don't have a home to go to, no, we're not taking them. And then again, the same thing with some of the behaviors or other challenges. Some nursing homes will screen them a lot tighter and not take them. What challenges do you see the rehab facility having in the future as we continue to move along? So that question was again specifically for rehab, and competition is always tight for short-term rehab. Again, because the payer source is higher, people want them. So we need to continue to position ourselves to become preferred providers with the local referral agencies. Regarding residents who have come from other counties, the only way for me to actually identify that would be to go into every resident record and look up the address of where they lived before they came. Because what our management system does is it tells us where they came from immediately before they came to us. And so for most of our residents, that is the hospital. So it will show if they came from a hospital, another nursing home, an assisted living or a personal care home, those kinds of things. So I can't say, but I know it's only a handful. Our residents primarily come from our county. Sometimes we will get neighboring counties like Monroe County because they don't have a county nursing home anymore, or because a person was in the hospital, it will be one of our regional hospitals. So a Lehigh Valley hospital like St. Luke's or Lehigh Valley, that's primarily where most of our residents come from. So those were the questions that we did receive by email.
Are there any other questions? Mr. Kapora?
If we can go back to the mental health piece, can you walk me through a day of a mental health resident?
Walk you through
Typically,
it.
they have a schedule, they have team meetings to discuss situations that they're dealing with. Is that occurring? Is everything virtual? Is there in person?
No, we do have in-person visits with the psychologist and the psychiatrist, as well as our team members. We do care planning meetings that we'll do in person. Whether the family attends in person or virtual is really up to the family's convenience. So if a family is local, they'll frequently come in. If they're not local, they'll call in or do a virtual meeting. So that's all on a case-by-case basis. We do, every morning, we do have a clinical meeting, and we talk about any concerns that we've had about residents and problem solve together. How can we manage that? What do we need to do? Do we need to make referrals? So we do handle all of that tightly. Residents do have therapeutic activities that they can attend, as well as, things that they can do on their free time.
Are they separated from the other residents?
We have 2 neighborhoods are specific to residents living with dementia. We do have some neighborhoods that are more geared towards some residents with behaviors. So we will try to problem solve that together. We have some neighborhoods that are all male, some that are all female. So sometimes that could be related to a behavior as well. So it's all individualized. Yeah, you're welcome.
Any other questions?
I would also add too, some behaviors are from dementia, and every nursing home is seeing more and more of that, because the biggest risk factor for dementia is being 80 or older. So as our population is living longer, we're seeing more people in their 80s, 90s, and when, we even have a few over 100. So there's 2 types of behaviors. One could be for a mental health issue, and another could be from dementia.
With your mental health team, and I guess the second group, not the Haven House folks, but the Vital Care, you said?
Vital Health.
Do they do cognitive testing? Or what if somebody, because obviously not everybody comes in there as a dementia patient, and some people
Correct.
decline obviously for various reasons. So at what point do you recommend, or are they teamed and suggested to have cognitive testing, and then who does that? Or do you have to send out or bring a consultant in?
Well, we have different cognitive testing we can do. So every resident does have a screening because it's a brief interview of mental status. So that's a cognitive screening, and that's actually part of the assessment form that we do for CMS under an assessment that's called the MDS, the minimum data set. So everyone has a screening for that as well as for depression. And then early on, our speech therapy can do a lot of cognitive testing. So speech, when people hear the word speech therapist, they typically think talking, but speech therapists also do cognitive testing as well as swallowing and other things. So they specialize in cognitive testing, so they can do more in-depth cognitive testing, and yes, so can the psychologist and the psychiatrist.
So what would be the wait time, or the, how long does it take? Because how many psychologists and psychiatrists do you
I
have?
wouldn't say we really have a wait time for that. I mean, Nicole, do you think we have a wait time? They're pretty quick, right?
You can't answer from afar. You got to come up to the mic.
She's good, yeah. No, I'm just confirming they don't wait. Yeah. They don't wait.
So how many people are involved with the Haven House component? Because I know when they first started, there were specific patients that were seen, but there was also a training component for the staff, and there's consultations. So about how many residents have a touch point or a part of their case management plan with Haven House?
Yeah, I don't know the numbers off the top of my head. I do know we have a number of them. I collected the numbers for the psychology and the psychiatry.
Ron, I'm sorry, did you have a question? You did? Or I heard you before?
Yes, a question is, well, 2 questions actually. The first is neighborhood. In my time, we didn't have the word neighborhood in the Graysdale. So what does that mean? What was the word at one time?
Well, one of the things that's really important to me is what's called person-centered care, which is actually now also part of the regulations. That term appears in the regulations many, many times. And so that's one thing I'm trying to help move us forward with. And the idea behind that is this is people's homes, as you mentioned yourself in your opening statement. People live here. We want to make it the least institutional that we can. Obviously, we can't always make it 100%, but we want to make it as home-like as possible. So one of the things that I like to do is words matter. And I think we see that in the outside world as well as within our nursing home. You know, terms that you call people make a difference, and terms that you use to describe things make a difference. So I've always said I hate the word unit. I say don't use four-letter words. Unit's a four-letter word. So I like to use the word neighborhood. I don't like to use the word facility, and I've trained staff that way. We don't use F words. Facility's an F word. Do you want to live in a facility? I think all of us would say, no, we don't want to live in a facility. So I call it we live in a community. And a community is a place where people live and work together, where they show respect for each other. They have both common bonds and similarities and purposes, but as well as recognizing individual differences and that importance. So when you hear me use terms that you may not have heard before, that's because I'm a huge proponent of person-centered care. And the regulations do support that now. And we're doing that, I think, throughout many of our operations, starting that journey. And it's frequently called in the field a journey because there's not an end. It's always, okay, what can we do more to do the best that we can for our residents? So some examples we're looking at right now is we had been very black and white on what we allowed residents to bring into their space. And I know some of you have had family members in this space, and our building is older, our space is small, but instead of being black and white, we're trying to look at, okay, you know, what's the impact of allowing more flexibility with that? So are they impeding egress for fire safety? The answer is no. Okay, that's fine. Are they infringing upon the roommate space? If they are, then we need to adjust. If they're not, so just being more flexible in all kinds of things and what belongings come in, and you know, our rules and regulations, you know, and saying, does it need to be so institutionalized? And I think that every one of us would agree that the less institutionalized we can make it, the better. If you have your family member there, you would appreciate that. If any of us are there in the future, and the regulations do support it and actually, you know, favor it these days.
Okay, I just was curious. So basically what you're doing is, in the past, I don't, you know, there weren't, you're right, they had different terms. And one thing about human services, it's never short on coming up with terms.
Mm-hmm.
But the thing is, we're putting people in neighborhoods, units where they're compatible, that addresses their needs, correct?
Correct. And then if you know, sometimes it could be a judgment call. So if we find out that the neighborhood they're in isn't the best place for them, or they might decide that, then we would work in conjunction with, we have a great social worker team, and they would help us say, hey, you know, this area is better suited to such and such a resident. Or, you know, if roommates don't get along, saying, okay, you know, how can we adjust? What can we do? And again, make that change.
I don't mean to get into the weeds, but I'm just curious. In the tower, I know the people that had their beds were by the windows, they had TVs. But if you were on the inside, you didn't have an access to a hookup for a television, a personal television. Is that the same?
No, that's not correct. Every resident has their own television.
Okay, well, you know, it's been a while since I was over there and involved.
I understand.
So I'm glad that's good. The other thing is bad debt. Are we aggressively going after the funds of residents?
Yes,
For example, a past. Okay, go ahead. I'm sorry.
I'm sorry. Were you going to say if a resident passed away?
Yes.
Yes, our accounting team is very good with looking at whether an estate was opened and going after any money we can get. I would say that frequently with our residents, though, you know, a lot of them are on Medicaid, and they wouldn't have been on Medicaid if they had an estate. So a lot of times there's not money to be had. But if there is, they do aggressively go after that. I would say most of our, you could think of it as bad debt, would be our MA pendings, because that process is so slow.
Yeah. All right. Well, I don't have any other questions at this time. Oh, the other one, yes, I do. The question is, when it comes to recruiting with the hospital, because you're right, the hospitals will call around, but these hospital social workers always have friends in different places. Have we worked on building relationships with referring agencies and hospitals and such?
Yes, we do, and that's actually part of our strategic plan, and so is recruiting and retention of staff.
All right, thank you.
You're welcome.
I'm done.
Thank you. Any other questions?
Is the administration and the union, is it true that they're trying to tell employees not to talk to council members?
That's not true.
I believe I heard more than just one. One said it publicly here, that the union said it. I heard that also the administration is trying to find out who's talking to council members. I understand the challenges that come with running a public nursing home. I understand that you're in the public light and you're new to your position, so I understand you're taking a lot of responsibility for things that you had nothing to do with. So with all that being said, I appreciate the position you're in. The position we're in is we're trying to siphon through and filter through information that some is truthful, some are being, rose-colored glasses, and then there's information that's out there, people that are working there, that is useful information, but they're being told they can't tell us. People are saying they're afraid to get fired and asking for whistleblower protection status for giving information that is A, public information, and B, we're a public entity here. I don't understand how that is. If you're saying that's not true, then you must not be aware of it, because I've heard that from multiple people.
I have never heard anyone say that. I have never told anyone that. None of my team has told anyone that. I can say that, rumor mills are big, and rumors come back to us of people having talked to certain council members, and the information that we were told that they said was not correct.
Well,
So I
wanna
think
give-
if someone is telling you something, then it needs to be verified, because the information that I heard recently was definitely not correct.
I'm not sure what information you were hearing about, but the information that I'm telling you, I want you to take home and say, okay, if this is happening in my nursing home, it needs to change, because there needs to be open lines of communication between the people that work there and the people that sit here. Otherwise, we're working in the dark.
I can tell you how I operate, and here I'm saying it in public. So I would say to our staff the same as I tell them when I teach them about talking to our surveyors when they come. I said, I highly believe in ethics. I don't believe in hiding things. I tell them when surveyors come, you're not to lie, you're not to hide anything. If we had a violation, then we accept that and figure out how do we fix it and move on. And I would say the same thing for any communication that they do.
Thank you. I don't know what we do about hearsay and rumors. I don't know what we do about it. And quite frankly, I don't know about all of you, but the rumors that fly around about me in this community.
I could tell you what I do about
wear this
rumors.
Pin. People think I'm gay because I wear this pin. I have a wife who's female and two daughters. The rumors are abound. There's hearsay everywhere in government, from the federal government to the state government, down to our local governments. I don't know what to do about it. I wanted to thank you for addressing the rehab issues. I had briefly mentioned at our last meeting that my mother was at Graysdale and had a fantastic experience with the rehab facility. 2 weeks ago, and prior to that, 2.5 months prior to that, it's been a living hell for my mother, being in and out of hospitals, being in and out of rehab facilities, to the point where Graysdale was her only option. I do not know what would have happened to her, getting back home, getting back to her apartment. I have no idea what would have happened, but Graysdale was there for her. So I want to thank the staff. I want to thank the nurses who took care of her, and I'm forgetting the nurse off the top of my head, but my mom said, gosh, I wish I could take you home with me that day when I picked her up and took her home. So just wanted to mention that and the personal nature which this is to me, but again, getting back to what I was saying, I don't know what we do about rumors. I don't know.
Thank you for that. So 2 things I would say is rumors do cause a lot of damage. When I hear rumors, I say, I'm not interested, because the only way to stop people spreading rumors is to say, I don't want to hear it. Many times they're not based in fact. It's not helpful. It just creates discord. And I would add to the piece about taking care of your family members that we were at Music Fest this week, yesterday. We were there from noon to 8, and we were also at Nazareth Days during the community fest there. And our table was busy, and we were actually across from another therapy group, and our table was much busier, and I'm not going to name them, but we had people constantly at our table, and many, many people at both events were coming up to say, I'm so glad you were there. My loved one was there, and it was a great experience. And I can't tell you how good that was for our team, because all this negative talk is very disheartening. We have team members that work very hard in every department. So to hear so much negativity a lot of times is disheartening for them. It's hard work. A lot of people just can't do this kind of work. So it takes a special type of person to do this work. It has to be a calling, and especially after COVID. As I said, many people left healthcare after COVID because they're like, this is not for me. So our team members that you see here now in every department, whether it's administration, nursing, including nurses and nurses' aides, this is their calling. It's in their heart. And so that was really heartwarming for us to be at those events and to hear that kind of positive input back instead of just being kicked down all the time.
I just want to clarify one thing. I think the reason why Graysdale's table was so busy is because, yes, the community resoundingly wants Graysdale to succeed. Nobody here sitting at this table doesn't want to see it succeed. But we keep hearing 2 different stories. One from, and of course, as the administration, not Graysdale's, but this is a political position, and optics are everything. So if Graysdale is not doing well, that doesn't look good politically or optically. So there's incentives to make things seem better. And then if a nurse is disgruntled or if somebody's upset, they have a motive to say, well, I want my boss to get fired. So we have to sift through that. But then we had a news report of a lady, that crazy story that came out, and there's, retention problems. So if we see high turnover rates, if we see $10 million that didn't go where it was supposed to, or $5 million, whatever the number was, where there's smoke, there's fire. And we're constantly being told everything's fine. So we're not trying to raise negative opinions of Graysdale. We want to see Graysdale be the best there is. But right now we're hearing from people that work there that, hey, there's issues. We need you guys to help out because we're not getting help where we need it. That's why we're having these talks. And, we're going to get a strategic plan, and we're going to talk about all these positive things. But it's talk. And what's going on there might not be exactly as advertised. And that's what we're trying to get to the bottom of. And we want to know, is it a realistic thing? Is what we're doing in 2025 with nursing homes, is that the way of the future, or are we trying to keep a sinking boat afloat? You're the one that's going to be able to answer that. Otherwise, we're just keeping throwing money at things, and it's not even going where we want it to go,
Well, I could say I obviously can't answer for the past because I wasn't there, but I assessed where we were when I arrived, and that's what our strategic plan is about, is how are we going to move us forward. I think the people that came to our table, the community wants us to succeed, but I think an important part of that was the thanks that we were getting. Many people were coming, not just in a generic support of Graysdale, but saying, I had a loved one there, and you did a good job. I can also say the numbers I gave you at the beginning with the staffing, those are real numbers. I mean, that's an actual number. It's
I believe
nothing
those
that's been
numbers.
doctored, as was previously suggested. That's the actual number. So I'm giving you the actual data.
I really do want to know the out-of-county people there, because that is something that really, and I understand that intergovernmental money, it's not all our taxpayer money, it's a paper. But at the end of the day, that place is for Northampton County residents, or at least that's what the people think they're paying their taxes for. So that number is vital information that we would like to get our hands on too.
do you want your taxes to pay for me looking at 500 different charts and find out their previous home address? I mean, to me, that doesn't seem productive. We know it's just a small handful. I know since I came, I know of one resident that was out of county.
We asked the question, then yes, it doesn't have to be you that does it, but we want somebody to give us that information. Yes.
Madam President.
Oh,
Go ahead, Kelly.
So, first of all, I have not heard anything disparaging, and I know that several other council members have not either. I have only heard positive things. I only hear positive things. I have friends that have family members in Graysdale. I have not heard one bad thing. My grandmother was there. It was a blessing that she was there. Graysdale is has 4 stars right now, so I don't know what you're talking about, Mr. Fredo. The attendance is up, and the only negative things that I hear about Graysdale are from that side of the dais. So I don't understand. I don't understand where you're getting your information from. A disgruntled employee? Is that who you believe? Thank you so much for saying that these things should be verified, because they certainly should.
When did you start again? Just a minute,
I s-
Ron,
I started March 17th,
of this year?
Mm-hmm.
Okay.
St. Patrick's Day, lucky day.
Yeah, I guess so, for you and for us. Did you have a chance to review the affinity study? Was that any part of your, or was that?
No, I haven't seen that.
And did you want to introduce the rest of the staff that you have with you here today, in case people have questions of them? Because we did ask.
Christina Casey is one of our assistant directors of nursing. Behind her is Beth Pivison, our assistant nursing home administrator. Next to Sue is Laura McFadden, our HR director. And next to her is Nicole, our director of nursing.
Ron, did you have
Beefinger,
another
I should have said
question?
your last name.
pardon me?
Did you have another question?
Oh, yes. Let me just say, I've had, my mother-in-law was at Graysdale, 2 aunts and an uncle. They received excellent care. I don't think anyone on council has disparaged or is disparaging the staffing. I could tell you, I can answer the question though regarding out-of-county residents. That actually happened when I was director of the department, and when I believe I still was, our census kept dropping, and it had been just county residents, but we opened it up for the benefit of the home because times were changing, and we needed. You not only need staff, you need residents to have the home operate. So that's what we did at that time. I don't, and I don't want this to become political. I know there are some that say, how dare we ask questions because that just makes it terrible. No, that makes it a good government. Government isn't a person. Government is people, and that's what we're doing here. I would never go after any employee at Graysdale. I said when I was director, I said I couldn't do that job, and I know a lot of people who talk big, but they could never do the job that are being done out at Graysdale. So I mean, I think we, recriminations aside, I think everybody wants Graysdale to succeed, and as a part of that, I know there's options that are brought up all the time. People don't want to be in a nursing home. They want to stay at age and place, and so on and so forth. The problem is, if you go, and I did years past, most people in the nursing home never thought they'd be in a nursing home, nor do they really want to go to a nursing home. So that's why they realize this is probably the last stop. And that's why you try to make it as homely as possible. It is their home, and it's going to be their home, and that's all of our responsibilities. But I mean, we used to get, the state would say, well, we'll give you a voucher. Well, they never gave enough money, and even though we had the money, there weren't enough people out in the community working for these agencies to come out and help because they pay these people nothing. And so it's a tough situation. We tried to get some legislation through to have some of the folks go to assisted living facilities. But the way the law is set up now, even those people that may be marginal, we would put into Graysdale, but they probably would have been fine in an assisted living, but they were on Medicaid and they won't take that. And, you know, they'd rather have the money spent in a home that costs 4 times, 5 times more. So the policies from the top down sometimes make no sense. I think they're going to have to because of all the old folks who are flooding the system. But I mean, Graysdale provides a vital service. I agreed that the first part. My mother-in-law was at the Country Meadows. They have a nursing home, but they don't take Medicaid. So once your resources are gone, you've got to transfer out. So I mean, it's a tough thing, and I just really don't. I hate, because I've been in this so long. I hate to see it break down into, well, you people are against it. No, we're the good ones. No, you're the bad ones. We're the good ones. It has no place when we're talking about Graysdale. We can do that about public appearances and where the checks get sent for public stuff. But I'd love to see that stop for Graysdale. But I do have a question for the director, and that is, are we still using nurses from that agency with that violent nurse was involved?
Yes, so I can't go into details because obviously that's in litigation. But what I can assure everyone is our agencies that we use, we require them to do the same background checks that we do for our employees. And for both of those, we're above and beyond the regulations. So we do more than is required, you know, because we want to be cautious. So we do all of that. We did all of our reporting and everything that we're supposed to do. So the incident itself is the only thing in question, and it's not something that could have been predicted.
All right, well,
She
I don't
had
wanna
a
get
clean
into- I know
license
the
in multiple
litigation.
states, and like I said, I'm not going to go into any detail, but we did check all of that. So there was nothing we could have done to predict it.
not-
There's nothing the agency could have done to predict it.
All right, well, I don't want to get into because the litigation stuff.
Yes.
I understand. They had an executive session, and I realize we don't get into publicly on litigation, but you can still talk about an incident without getting into specifics. And the question then would be, I heard what you're saying. We're depending on these agencies to do a great job on going through the rules that you mentioned. But something that I used to have a knowledge of and I don't anymore is, I know we pay the agency a certain amount, and then that's broken down per nurse. But do we know the exact pay the nurse is getting as opposed to the agency as a whole?
Not really. We did ask them to provide that, but of course, most of them don't want to disclose that. So we know what we pay the agency. We don't know what the individual themselves are getting out of that, because of course the agency gets its cut.
So the agency, you know what you're paying for X amount of the people from the agency. Is it broken out by how many people you need?
No,
Or is it a flat amount?
we pay an hourly rate. So if we use an agency, we have to pay an hourly rate, and there's a rate for like RN, a rate for LPN, a rate for aide. So we pay what the hourly rate is. And so we pay that for the
Okay.
actual hours worked. There's no flat fee of any kind.
So it would be helpful, and this would have to come from the state, I would assume. It would be helpful if they had to disclose to you what their rate is for individual positions that they're paying.
Yes, it would be helpful. And we did recently ask them all if they would provide that information. And they're not very willing.
No, I could understand that. Most of these places, unless they're forced to, they're not gonna
Yeah.
do that. But all right, well, I appreciate that. Thank you very much.
You're welcome.
Madam President, can I speak? I have a few things. Is there an amount of time that an agency nurse can work there? Because it seems like they have found a loophole to not become a Graysdale nurse. They could just keep collecting their huge amount of money from these agencies. Is there any way you could say, you could do this for 6 months and then you're done? Like, then you go back to the agency and the agency places you somewhere else. Is there any way to stop this?
There's not a way to stop it per se. I mean, one of the things that we're looking at is how can we encourage them to become part of Graysdale versus the agency? And I think one of those things is everyone thinks it's always money. And I agree that money is a part of it, but studies show that people get invested in workplaces where they feel part of the mission, part of the organization, feel that they're making a difference. So we want to look at some of those things and say, okay, in addition to, assessing money, what else helps bring people on board? So we are looking at those kinds of things as well. I do have an agency nurse that I think might convert because that person is a valued part of the team and involved on a committee that's helping to make things better. And we needed him because it's a specific committee for his floor. It's a quality issue that we're working with residents living with dementia. So we need the team that's working with those residents to be part of it. And so he does come to that meeting, and I think that's actually making a difference.
They're taking advantage of us. That's what they're doing.
Definitely.
There is a name for it. It's called cash cows. The next thing
That's why
is,
some states did limit it, and Pennsylvania's not one of them.
the next thing I want to say is, Ron, you talk about that we don't pay a lot. When I graduated nursing school, many of my friends that I graduated with went to work for Graysdale because they made so much more money than the starting salary in the hospital. That's a fact, and they probably still are working there to this day. Not only do they get paid more, but they get a pension after 5 years. That's a huge incentive. So, the county does provide for these people. And then the other thing I want to say is, Ron, you keep saying that you don't want us to go at each other and you want this not to be political, but you keep tolerating the other side at disparaging Graysdale. And then you keep saying that you don't want us to go at each other. We all have our own opinions, and we're talking about it. And you're a big proponent of talking about things, so that's what we're doing.
Can we move on to your strategic plan?
Certainly. I had passed out copies last meeting, but I bought a few extra in case anyone didn't have theirs here.
Does anybody still need one?
Ron, did you get one sent to you?
Thank you.
Ron? Hmm? He did.
Everybody good? I have two more.
What?
All right. Alrighty, so I'm going to go through it even though you have it in front of you because people in the audience don't have it. So we start with our executive summary. Graysdale has undergone many transitions since the property was first bought by the county in 1837. We started as an almshouse for the poor, then eventually transformed into a more traditional nursing home in 1950. As a nursing home, our operations have significantly changed over the ensuing years. We now serve a more varied population with an increasing number of younger residents facing mental health challenges. In addition, we have faced numerous challenges such as implementation of the MEGA rule beginning in 2017. The MEGA rule was when our regulations were rewritten, and they're called the MEGA rule because it's like over 900 pages. We're now #1 in the country as far as regulations. We used to be second behind the nuclear industry. Now we're #1. And that's just counting the nursing home specific federal regulations. It's not counting any other regulations that any business has to follow, and it's not counting the Pennsylvania nursing home. It's just the federal alone is huge. So that was a huge overhaul. And then, of course, came staffing shortages and the worldwide pandemic. What hasn't changed is our mission to meet the medical, psychosocial, and spiritual needs of the residents of Graysdale while maintaining the highest possible standards of care in the most efficient manner. Our leadership has changed greatly in the past year, with at least 8 members of our leadership team being new to the organization or new to their role. So this made 2025 a good time to evaluate what we're doing and how best to position ourselves to address our current needs and challenges, as well as develop aspirational views for the future. So our leadership team met together to begin the strategic plan. And our first step, we completed a SWOT analysis. So we analyzed our strengths, our weaknesses, our opportunities, and our threats. And I would say that even that process of developing the SWOT analysis was a change in our process. So we were moving more from department head meetings that were more informational sharing to meetings that were collaborative and engaging. So we did our SWOT analysis, and when we looked at that, it became clear that we had 4 themes that we wanted to focus on. And I think you would all agree with these from the conversations we've already had. Our focus is our residents, our team, our community beyond our campus, and our financial performance. So then before we finalized our goals and objectives for each of these 4 themes, it became important for us to develop core values. We already had a mission statement and a vision statement that served to define our efforts, but we needed additional guiding principles to solidify and sum up our identity and answer what is important to Graysdale. So we collaborated on that. I asked that question, what is important, what things do we want to say this is Graysdale? So I collected all of those themes, and then we were able to group them into these categories that you see here that spelled out the acronym GRACE. So our values are grace and kindness, respect and dignity, accountability and integrity, collaboration and teamwork, and excellence and innovation. So after we did our SWOT analysis and our core values, then we moved on to look at our strategic goals under each theme. So our goals are reflective of our mission, vision, and core values and give us a clear direction for our future. In spite of the many challenges we face, this direction is positive and reflects the collaboration and engagement of our leadership team with a coming focus of more collaboration and engagement of all Graysdale stakeholders. I already went over our mission statement. Our vision statement is to improve care outcomes such that Graysdale Nursing Home is a preferred facility for area referral sources and a facility of choice for prospective residents and employees. To go into more detail on our core values, grace and kindness, we want to treat others with compassion, empathy, and kindness, foster connections, and expect the best from everyone and don't make assumptions. Respect and dignity, treat everyone as an individual, be person-centered, take time to listen, prioritize the needs of people. Accountability and integrity, conduct our work honestly with transparency and openness in all transactions. Follow not only regulations, but also best practices. Foster trust. Collaboration and teamwork. Work together on common goals, both within our campus and the community at large. Excellence and innovation. Be flexible and try new things. Take quality personally. Foster a culture of creativity and continuous improvement, and incorporate fun into our work. So next we have our SWOT analysis, so I'm not going to read all of that, but we looked at our internal strengths, so what's our competitive advantage, what resources do we have, what are we doing well. We looked at our weaknesses, and that's internal as well. Where can we improve? Where are we lacking resources, and where are we underperforming? Then we looked at our opportunities, and that's external. So that's what new technology can we use? How can we expand operations? Can we form stronger partnerships? And threats would be, again, external but unfavorable things. Things like what regulations are changing, what are competitors doing, how are consumer wants changing. So once we did all that, we did come up with our strategic goals. So Number one was to achieve consistent staffing and decrease agency usage by decreasing our staffing vacancy rate from 59% to 30% by June of 2026. So those, again, were real numbers. That was our current vacancy rate at the time we did this. So we have a clear goal. We wanted everything to be clear, so when that time approaches, we'd be able to look at it and say, did we meet our goal or didn't we? And I would add that with all of our goals under this, things are flexible because as we go through each month, we'd be looking and say, how are we doing? Are we on target or do we need to readjust? So some of the things we want to develop, we want to develop a recruiting and onboarding program that hires for behavioral characteristics. So we want to look at, not just as someone qualified, but what is their character like, hiring those right people. We want to provide support to new hires so that they successfully transition from probationary employee to standard employee. So many times we hire someone and they, don't finish their probationary period before they move on. So we want to stop that and say, okay, how are we supporting them so that they move on with us? We want to provide education to our staff so that they are better able to meet the needs of our residents and to perform their essential job tasks. So this includes supporting staff to participate in training so that they are relieved of their duties and can attend training, which is one of the things we did with that mental health first aid. We made sure that there was someone filling in so that the staff who attended the training were able to attend. So we'll be continuing things like that. We're working with staff development to do more trainings that are short little, I call them training huddles, where you may gather a group together for 10 minutes, because you can't always release someone for a full day. There's times where we want to do that, but we also want to provide more on the job, like, okay, let's do this training and do it frequently so we get a lot of training in. We want to develop an employee engagement program that supports employees in thriving at work, as well as incorporating a sense of joy and fun into our work. So we actually have started that committee. So we have a group of team members that meet and they plan events for our team members, again, to make it a fun place to be. To recognize the good work that employees do through an official recognition programming, honoring employee contributions to our mission. We also want to grow our mentor program, and we want to adopt an anti-bullying campaign. Under number 2, to improve service and care outcomes so that we score at least an average of 3 out of 5 on resident and family satisfaction surveys. Oh, and I would say that here's an example of how we're adjusting. Under number 1 with the staffing, our engagement committee has developed an employee satisfaction survey, and they decided to send that out in October because they wanted everyone to be back from summer vacation and things like that. So that's going to go out in October. So that way we'll be getting feedback from our team members that we can use to add to our plan. And then we can also see improvement because we'll have a baseline number. So to get us 3 out of 5 on resident and family surveys, we want to improve our environment for residents living with dementia by offering specific programs and environmental amenities to meet their unique needs. So we actually, as I mentioned earlier, do already have a committee for one of our neighborhoods for our residents living with dementia. And that's been great so far. We've had, I believe it's 4 meetings. We have a nurse's aide in that program, a housekeeper, because sometimes people forget housekeeping. They're in and out of resident rooms every day. They know our residents. So we have a housekeeper, and she's awesome. She's actually taking on a leadership role within that committee. We have the restorative nurse's aide in that program, a nurse. Christina comes to that. I go to that. So it's a good interdisciplinary program, which we're already seeing success with. To provide behavioral health services to our residents living with mental health challenges by improving staff understanding and responses to residents. And that is part of why we added in the psychology services with Vital Health. We already had the psychiatrist services, so the psychology services are relatively new. We want to improve our quality measures, especially with decreasing falls with injury, improving function scores. So function scores were how residents are able to do for themselves. So we want to see those scores go up because that's an area where we could be better. And reducing hospitalizations. We want to begin the person-centered journey to decrease institutionalized and increase homelikeness. We talked about that already. And because this was important to our residents, it comes up frequently in resident councils, we want to improve our Wi-Fi to accommodate growing demands on our system. We have more and more residents that are using, wireless devices and streaming and things like that, so it's taxing our system. And we want to achieve level 2 of an age-friendly health system. And I want to throw kudos out to Nicole for that, because she spearheaded and we already achieved level 1, so now we want to move on to level 2. And that's an example of how our plan was already updated. When we first wrote it, it was to achieve level 1. Well, we've already accomplished that. Under number 3, we want to increase our involvement in the larger community, so meaning outside our campus within the Lehigh Valley. We want to be involved in at least 2 community events per quarter. We want to become involved in area groups such as Lehigh Valley Aging in Place, which we're already doing. We want to work with our county community development to identify and become involved in appropriate community events. We've already started that and have been involved in some things through them. And we want to develop on-site campus events to bring people onto our campus. So we do already have some of those scheduled that will be coming out this fall. And we want to implement an interdisciplinary committee to work on community engagement initiatives. So we already do have that committee put together, and it involves multiple disciplines. So it's not just marketing now, it's other disciplines are involved in saying, how can we get involved and become an important part of our community? And then financial stability. So we want to achieve financial stability on an ongoing basis. And you will see when we do our budget presentations later this year that we are presenting a 0 budget. So our budget is balanced. We want to implement lean operations, and I talked about this at a previous meeting. Evaluate and identify opportunities to operate following lean principles, not just in fiscal operations, but also our operations and practices. So look at, okay, what are we doing? Is it efficient? Are there processes that are redundant that we could eliminate? All those kinds of things that go into lean principles. We want to implement new PDPM guidelines to optimize financial reimbursement. So the patient-driven payment models is something that had come out with our guidelines on how we get reimbursed for our short-term rehab. It used to solely be reimbursed on the number of therapy minutes. That had changed where it's more about not just therapy minutes, but also how clinically complex a resident was and how much time they needed from staff. Well, that's moving on beyond just short-term rehab now. So it's a whole different reimbursement model. So we obviously want to successfully implement that. And we want to continue to develop census to surpass our census goals and develop partnerships and become preferred providers with area hospital networks and other referral sources. So, and as I said, it's a working document that we've already implemented the beginnings of the majority of that, and we'll continue, and we'll also adjust as we go along.
Any questions?
It says decrease our staffing vacancy from 59% to 30%. Are those numbers accurate?
Yes, because the numbers that we talked about at the beginning of the meeting today were nursing, meaning nurses and aides. So we also have openings in other departments. So that number factored in departments like housekeeping, dining, et cetera.
Those positions are have been easier to staff in the past, I'm assuming.
They've struggled more since COVID too. I would say, for example, dining departments in nursing homes traditionally rely on high school students. Especially for the afternoon and evening servers type of positions. And I've seen a lot of nursing homes struggle with that since COVID. And some of that is their parents. Like parents pulled their teens out during COVID and then we're like, I'm not letting you go back to a nursing home, and that's persisted. So that is something that, we do have trouble. Dining has especially had trouble with staffing too.
Makes sense, thank you.
Why the anti-bullying campaign?
Because one of the things that we hear when we do the interviews when someone leaves, a lot of staff say they leave because of how other staff might treat them. And I think that becomes an issue, I don't know if I would even say it was always intentional. I think it might be that if you have a group of people who have been there for a while and they work well together because they know each other, and then how do you help someone that's new fit into that and say, okay, you know, you have this core group of people that have this already ongoing relationship with each other. How do you help ease someone new and feeling comfortable breaking into that?
And this seems pretty comprehensive, but a little overarching and not specific. So is there a part of it that you have broken down into some other layers? Because obviously, when you look at the reimbursement and some of those things, it's not as simple as this.
Yes. Obviously, I was very new when I, worked with our team on this. So what we did is on the numbered portions of it, those have measurable statistics in there. But then under the programs underneath that, we wanted to leave that a little bit more open so that when we form these interdisciplinary committees, that the committee could be part of helping identify what do we want this to be. Because I really do feel that being collaborative and getting other team members involved, and especially what I like to call the front row staff, which is a person-centered term too, because some say front line, and that can have a negative connotation. So I think saying front row is more positive, that we want to get team members who are actually doing the work involved. And one of the reasons for that is not just the collaboration, is if only our leadership team was developing the plan more fully, then you don't get that buy-in. Then you'll hear from other team members like, oh, yeah, great, here's another thing they want us to do. It's just a directive, and they want us to do this, and can you believe this? Like, this doesn't make sense. And things that sometimes look good on paper don't always work well in practice. So I wanted to leave it open. So for example, with that committee we have for the neighborhood for residents living with dementia, we have the housekeeper there, we have the aide there, we have the restorative aide there. So that way they're a part of saying, hey, this what makes sense for what we're doing, versus us just saying, here's what we want you to do. That way they have the involvement in shaping it more fully.
Thank you, Madam President. I think this is a very solid document. I
Thank you.
think the strategic goals and plans are very doable in the future. I do have a question about, and I think it's honest. This is a very honest document. You're not only talking about strengths, of course, but you're talking about your weaknesses, challenges, and opportunities. Under the weaknesses area of mental health resources, behavior, dementia, mental health training, can you maybe go into that a little bit more from what you're inevitably hoping to see with regard to, especially from a mental health training standpoint, because mental health community, there's data out there, things are changing all the time, especially coming out of the pandemic and what folks have gone through in different professions is something that needs to be addressed. I think from a societal standpoint, that's a topic for another time. But in terms of, what you want to do in terms of that training with mental health, what are your thoughts there?
I would say, the first step obviously is helping our staff understand some of the different mental illnesses. I think it's easy because when we're caught up in, how much work we need to do every day, people get caught up in thinking, oh, this behavior and this person is just being difficult. So if they can understand the person's not trying to be difficult, their behavior is a result of their mental illness, and helping them understand it, and then helping them understand how to respond to best help that person. And recognizing early, sometimes we get residents that could escalate to the point, that we're calling an ambulance. It's like, okay, well, how do we help our team recognize those signs and symptoms for that individual resident that's showing they're beginning to struggle? So how do we respond and support them that we keep them from escalating to that level? And if they do escalate in spite of doing everything that we possibly could, how do you then manage that? And I would want to be able to not only see the outcome for our residents, but also to survey staff. saying, okay, how comfortable do you feel dealing with this now? And then in the future, saying, okay, how comfortable do you feel? Or you feel that you can respond appropriately?
Again, a very honest document. Kudos to you and your team on
Thank
putting
you.
this together. Great job.
Thank you.
Aaron, and listen, I love that you're optimistic. I have maybe a little bit more of a pessimistic outlook. I see the inflation, the cost of living, wages, even in the private sector, are struggling to keep up. And in the governmental sector, it's going to be even worse. And that's why we're heavily relying right now on agency staffing. We can't keep up. We're trying. I said something pretty radical, and the people that I was talking to were in the union, they were shaking their heads. I was like, I don't think your union's guys doing enough for you. I really think merit-based and getting people, the best nurses getting paid the most, because you have basically agency staff or the agency is getting double what our staff is getting. So how do you not get retention unless pay your people more? And how do you not pay your better people more and attract better employees? I think it's pretty obvious how you fix a problem, but it's just really hard to do under the model we're working in. You have negotiations, you have people not feeling represented, people that say they can't talk. It's a broken system. And if we don't make any drastic changes soon, I heard people scoffing when they said, like, oh, well, we're going to lose the home. We can't. We had economic development. Every person that came in here was like, we're getting cut, we're getting cut, we're getting cut. Everybody can make it political, and it's like, oh, yeah, big bad Trump's cutting everything. At the end of the day, we're in debt at every level, state, federal, county. We're in debt. People have less savings. People aren't making as much. Money is an issue at every level, in every arena. So if we want to see Graysdale survive, we can't keep doing the same thing. Because if we keep doing the same thing, I don't think you're going to see 30% in 2026. I think it's going to be where it's at now or worse, because the only thing that's getting worse is the cost of living. It's getting higher. So people aren't going to take a pay cut to come work here because of a strategic action plan. They can't live.
The only thing I could say about wages as far as being in the strategic plan, like, that's not in the scope of myself or my leadership team to
I know.
address.
And
So
that's why
I put in
you're
the
up
plan
here.
what we can address.
I'm not blaming you.
Yeah.
I'm just, I'm talking universally here. I hope you don't take any of that personally, because it has nothing to do with you. You have no power in that arena. But we direct each other awfully candidly here. And I'm trying not to direct anybody. I'm just speaking out into the ether. If we want to change Graysdale, we have to change the way we've been running it. It's a different time, especially post-pandemic. We have different challenges, and then government has a very hard time keeping up with those things. So I'm glad you guys all came here today, because I think Graysdale deserves a meeting on its own. But really, we're not saying anything new, and we're not doing anything different. And I've a fear that we're going to keep getting the same results.
Madam Chair,
Go ahead.
I have to agree and disagree with Mr. Goffredo. The parameters of Graysdale may change, but Graysdale is necessary. Unfortunately, the federal government and the state government, regardless of party, and by the way, I've talked to many people over the years, now that I'm closing out, and I've talked to people who were residents of Graysdale, worked at Graysdale. The last thing they care about is whether it's a Republican or a Democrat. They really don't care. Once we get elected and we're there, I serve the people, all the people who support me, people who don't support me, and I know there's quite a few. But in the election, I politic. When you get elected and you're sitting there, your job is to work with everyone for the betterment of everyone you represent. I would say to Mr. Goffredo at this point, as I said to Mr. Brown at one point, we may change our strategy. We may have to put money in to keep Graysdale. We may have to come up with a plan that addresses what can we do and what we can't do. But I know going back, and people hate when I do that, but history is part of our reality. And the fact is that county employees felt like they were part of a family. That there was a real sense of that, and we've lost that. We've lost that. It's not just this administration, previous administrations. And now it's becoming boss, worker. And that's sad. But I do agree, though, that yes, wages, we've been pumping the pension thing and benefits for a long, long time, and it worked. But people cannot afford $2,000 a month rents and $700 a month leases on cars with you know, a promised pension. The workforce has changed. When I was in the workforce, pension meant a lot. A lot of the people I talk to that with their kids, they don't get money. They need money. They can't live here. And since we've decided to gentrify the Lehigh Valley and you know, cater to more of a transient population coming in with money in their pockets, we've sort of lost something in the process. So I would say that what Mr. Goffredo is talking about, merit-based, in our governmental system, I don't see that happening. So in the meantime, how do we figure this out so that we can at least move forward? I'm a proponent of pay, and I'm a proponent of saying if we have to subsidize that with tax money, that's what we do. We spend taxes on all kinds of things, and people will either support you or they won't. But you got to forget about that. Just like you got to forget about what party you're on, and when we're working up here, it's as Kennedy said, it's not about a Republican solution. It's not about a Democrat solution. It's finding the right solution. So I hope that's what we can do, and I wish you luck with your plan. Thanks.
Thank you. Ms. Keegan?
Okay, so I just want to give you an equivalent example. Travel nurses in a hospital make, I don't know, over $100,000 a year, $120,000 a year. They can make double what a nurse has been making in the hospital who has been there for a long, long time, 10 years. And it creates a lot of problems. And Ms. Fargo Hefner, you asked about why do you have an anti-bullying campaign? I could see that because when a travel nurse asked me where something was and she made 3 times more than me, I felt like, why do I have to help you? You make 3 times more than me? You should know the answer. So I could see that. I could see a lot of problems between the Graysdale nurses and agency nurses. My suggestion is put a cap on it. You work 3 months here, and then your time is done. You go back to the agency, go somewhere else, send us new nurses. They are taking such advantage of us, and the bleeding's got to stop. So that would be my suggestion. And the other thing is, Graysdale is not in debt. That is a lie. Stop lying to our constituents. Stop lying to the county. You have no evidence of it.
Kelly,
No,
don't
I'm
accuse me of
talking.
lying.
I have the
Mr.
floor.
Goffredo.
Don't accuse me of lying.
I have the
Because
floor.
you don't have the
Goffredo.
facts. You can have the floor, but you don't have the facts. So don't accuse me of lying.
Neither do you, and you
Yes, I
keep
do.
telling everybody lies. So stop it.
I'm going to ask you both to stop at 6:22. You get 1 minute, and then you have to close. I have to close this meeting.
Okay, I have 1 minute?
Or less, if you keep, let's go.
Okay, it is your opinion. You keep asking the same question over and over in different ways, and you want an inconsistency. You want somebody to say something different. You are trying so hard to put Graysdale under the bus. And you keep saying that it's not what you want to do, but it's exactly what you're doing.
I want to thank you for being here. I want to thank your staff for being here. If they want to come back anytime and highlight a specific part of the program, it's welcomed. I'd like to hear more in the future about the quality control measures and some of the funding stuff. If you want to do a deeper dive in that as you navigate that, it would be important for us to hear the changes because I'm used to what was, and I think it's important for us to learn that so we understand that. Anything else before I close? With